If we see, there are about 41 questions asked from the PSM subject. Out of those 41, 3-4 questions could be the overlapping questions between pediatrics and biochemistry. Now these are recall questions. So exact language may not be what has been asked in the examination. Options may not be exactly the same which has been asked in the examination, but we can have an idea that from which high topics the questions has been asked and what type of questions are asked in this examination. So let's start discussing questions. Now first question, complications seen with mumps, and we all know that it is epididymoorchitis, and we had clearly discussed this topic in our live classes, online classes, as well as in our Missed Next app about the complications happening because of mumps infection. As in children, there is possibility of pancreatitis, oophorytis or orchitis seen in postpubertal or adults, and there is encephalitis or meningitis is also seen. So these are few complications of mumps infection. Now next question is, a 5-year-old child presented to the clinic with complaints of fever, swelling in the neck, giving bull neck appearance, and the image has been given clearly showing the bull neck appearance, and the diagnosis is diphtheria. And this also we had discussed in our classes, with especially focusing the clinical features as bull neck appearance and the swelling in the neck, and with the image we had discussed this point. Next question, the survey of 4 cities A, B, C, D reported the total fertility rate as 2.1, 2.4, 2.6 and 2.8 respectively. Which city had achieved the desired goal for TFR? So what the TFR is, it is the total fertility rate. Means the total number of the children born to a woman in her entire reproductive period. And our goal is to achieve the TFR to 2.1 because this will stabilize our population. Because our goal for net reproduction rate is 1, to achieve the NRR to 1, our TFR should be 2.1. And to achieve the TFR to 2.1, our couple protection rate should be more than 60%. So the answer is 2.1. And this concept also we had clearly discussed in our classes. This is the screenshot from the class notes where we had specially highlighted that TFR should be brought to 2.1 to achieve NRR to 1. And this is only possible if our couple protection rate is more than 60%. Next question, the orthotolidine test is used for detection of. The chlorine demand is assessed by Horrocks apparatus. Free residual chlorine, it is by chloroscope. Combined chlorine is by orthotolidine test. And if you want to assess the free and combined chlorine separately, it is by orthotolidine arsenide test. So the correct answer is, it is combined chlorine can be detected by orthotolidine test. And this is also the screenshot from our class notes. Low stationary phase is which phase in the demographic cycle? We know the different phases of the demographic cycle are, and this is also the screenshot from the notes what we had discussed in our classes, that the demographic cycle is in 5 phases. The phase 1 is high stationary phase, the phase 2 is early expansion, The phase 3, late expanding phase. The phase 4 is low stationary phase, where our birth rate and death rate is very low, almost equal, so our population is stationary. And the phase 5, it is the reversal phase where population is declining. So the correct answer to this question, where the low stationary phase coming in phase 4 of demographic cycle. Maximum money under PMJ Yojana is 5 lakhs. And this already we had discussed with the logo of PMJ, that is Pradhan Mantri Jan Arogya Yojana, and where the maximum benefit which is being given to a family per year is up to 5 lakhs. Total number of the children born to a reproductive female is calculated by. Now these are different demographic vital indicators. General fertility rate is the total number of the live births per 1,000 reproductive age group women, means between 15 to 45 years. Total fertility rate is the total number of the live children born to a woman in her entire reproductive phase. The gross reproductive rate is total number of the girl live children born to a woman in her entire reproductive phase, and net reproduction rate is that out of these girl children born alive, how many girl children are remaining alive till their own reproduction is net reproduction rate. And this we had already again discussed as the various vital indicators of the demography as crude birth rate, crude death rate, general fertility rate, general marital fertility rate, total fertility rate, gross reproduction, and net reproduction rate. And there are few population indicators also, which we had also discussed as a sex ratio, dependency ratio, population density, and literacy rate. So here the correct answer to this question is the total fertility rate. Health worker has 2 open vials, one each of the DPT and MR vaccine. Now what is done next? As we know, as per the guideline of open vial policy, it is applicable for the vial which are in multi-dose vial form. What it means? It means those vaccines which are in the powdered form, if we are dissolving them with a suitable diluent, we should be using them within 4 hours. Otherwise, we have to discard. And we know that DPT vaccine is a multi-dose vial, while MR vaccine, it is in a powdered form. We have to dissolve with distilled water before its use. So if an open vial is with us with the DPT and MR, so we can use the DPT for the next 28 days, but we have to discard the MR vial which cannot be used beyond 4 hours. So with this concept, so options are discard the both vials, no. Use both the vials, we cannot use both the vials also. Discard the DPT vial and use the MR vial, no. We cannot use the MR vial, discard the MR and use the DPT vial. This is the correct answer. And this concept we had also discussed in our lectures, that it is the open vial policy which is applicable for multi-dose vials like the DPT, TT, hepatitis B, TD and the pentavalent vaccines, and we have to use within 28 days of their opening, provided the cold chain is properly maintained, the vaccine is withdrawal with aseptic precautions, and vial should not be merged in the water, and the date of opening is written on a vial. When all these guidelines are fulfilled, then only we can use these open vials, especially the multi-dose vials, within next 4 weeks. Another question based on the same concept, the vaccine follows the open vial policy. Now BCG vaccine, as it is the powdered form, dissolved in normal saline, so not following the open vial policy. Pentavalent, it's a multi-dose vial in the liquid format, yes, follows the open vial policy. Japanese encephalitis, again it is in the powdered form, dissolved in phosphate saline buffer, again to be used within 4 hours, so not following the open vial policy. MMR vaccine, again it is in the powdered form, dissolved in normal saline, so it is dissolved in a distilled water, so again it is not following the open vial policy. So the correct answer for this is it is pentavalent vaccine. Which vaccine has seroconversion time less than incubation period for that disease? Now flu vaccine, flu, the incubation period is very short, it is less than 7 days only, and whenever we are giving a vaccine, minimum 5 to 7 days are required for antibodies to develop, and for some vaccines it might be requiring 2 to 4 weeks also. So flu is not possible. Now measles, as we know that the incubation period of the measles is 10 to 14 days, and if we give the vaccine within the first 3 days of an exposure, within the next 7 days the good amount of antibodies are produced. So the antibodies are produced means the seroconversion from the seronegative individual to the seropositive individual is in less than incubation period of that particular disease. So yes, this is possible. Now rubella, again here the vaccine is taking around 2 to 4 weeks time for good amount of antibodies to develop, and this is same for the mumps vaccine. So here the correct answer for this is measles. And this concept again we had clearly discussed in our live lectures as well as online classes and mobile applications, that whenever we are giving the measles vaccination, it can be the pre-exposure, means before the exposure of a child to a affected individual, we are giving the measles vaccine as per the routine schedule in the 2 doses. The first dose we are giving at 9 to 12 a month, and the second dose we are giving at 1.5 years. While post-exposure prophylaxis, we can give the measles vaccine if we are giving within 3 days of an exposure. This way is specially highlighted, and because within the next 7 days the good amount of antibodies are produced, or if a child is immunocompromised, in that condition we are giving immunoglobulins. So this is about the measles prophylaxis. Now, worker responsible for active malaria surveillance. It's a very commonly asked questions, repeatedly asked in the examination, and the correct answer, you all know, it is multi-purpose worker male. But as here they had not mentioned the male or female, so the answer to this question is multi-purpose workers. And we had already discussed this point also so many times while discussing the functions of multi-purpose workers, that they are responsible for the treatment of the common diseases as they are posted at the subcenter where we don't have the medical officer. So they are treating all the individuals who are coming with some basic problems to subcenters. They are also giving the immunization, responsible for chlorination of the well water. We highlighted the point that the active malaria surveillance is the most important function of these multi-purpose workers, in addition to some other workers which we have discussed in great detail in our classes. Lowest center where patient can go. We know as per our healthcare system, we had some workers and the centers in the village, like in ICDS centers, and the workers we had as ASHA workers, village health guides, and traditional birth attendants. Then we have the sub-centers, primary health centers, community health centers, and onwards. Now here, as ICDS centers or sub-centers are not in the option, so the lowest center where the patient can go is primary health center. Disease caused by given a mosquito, and you can very well identify this mosquito by its sitting position. It is sitting parallel to the surface without any spots on the body. So this is your Culex mosquito, and we know that malaria is caused by Anopheles. The Japanese encephalitis is by Culex mosquito. The dengue and the Zika virus disease is caused by Aedes mosquito. So as you had identified correctly, this is your Culex mosquito. So your answer is Japanese encephalitis. And this point we had discussed again in the classes in great detail, where we had discussed the various insects with their images and the various diseases caused by these insects, as well as that how we can differentiate the various types of mosquitoes, differences in their adults, differences in their eggs, larvae, and the pupas in the great detail we are discussing in our classes. Incineration process is used for which color bag? It's again a repeatedly asked question, and I hope everybody might have marked this answer correctly. There should not be any confusion. Yellow color bag is discarded by incineration, while red, white, and blue color bag content, first we have to do their disinfection, and after the disinfection we are doing their disposal. So the yellow content are disposed of by incineration. Which is the principles of primary health centers? Unequal distribution? No. It is actually the equal distribution or equatorial distribution. Appropriate technology? Yes. Money? It is not a principle of primary health centers. And inter-country control? No, it's an intersectorial coordination. So this is again the screenshot from your class lectures, that the principles of primary health care, it is equitable distribution, community participation, intersectorial coordination, and appropriate technology. And what are the elements of primary health care? We can remember by a mnemonic elements. Just a minor difference from elements to elements, and it is the health education, the locally endemic disease prevention and control, essential drugs, MCH care, immunization, nutrition, treatment of the common diseases, and safe water supply and sanitation. So we are learning community medicine with mnemonics. So it is very simple and very easy to remember and recall in our examination. Most cost-effective screening test for cervical cancer. Now here there is some controversy in the question. Some students are saying the question was which is the best screening test for the cervical cancer, and some students are saying it was the most cost-effective screening test. So my dear friends, if the question is the most cost-effective screening test, then your answer from the given choices is Lugol's iodine, because this is performed at the primary health center and minimal cost is required. And if the question was which is the best screening test for the cervical cancer, then your answer should be pap smear. So remember one point, that answer changes with the question as well as with the given choices. If we see that what are the various screening tests we are doing for a cervical cancer, and this we discuss in great detail, that in the periphery at the PSC level we can do the wire test and the Willi test. So this is an image of a wire test where we are applying the acetic acid on the cervix after exposing by putting the cuspo speculum, and unhealthy area where nuclear chromatin material is more, so it is being precipitated by acetic acid, and we find the aceto-white patch. So if the aceto-white patch is visible after applying the acetic acid, it means that area is suspicious and we have to do the further evaluation. Now if we are applying the Lugol's iodine, the test is called as a Willi test, that visual inspection of the cervix after Lugol's iodine. Here the interpretation is different from the wire test, and here the concept is that healthy tissues or the healthy cells, they are having more of the glycogen, because if it is a suspicious pre-malignant cells, they are rapidly proliferating and they are utilizing their glycogen. And this Lugol's iodine, it is forming a purplish blue color with starch material, which is deficient in unhealthy cell and which is present in good amount in healthy cell. So if we paint the cervix with Lugol's iodine and we find that purplish blue color is there, so this is your healthy area, and where the colorless patch is there and this area is suspicious, which is not having any color. So if we find the suspicious patch as a colorless after applying the Lugol's iodine, and we find a white patch as suspicious after applying the acetic acid, then we have to do the further evaluation. And these are very simple tests. They can be performed at the PSC, and it is not requiring any microscope, it is not requiring any expert cytologist for the reporting. But if we want to say that which is the best screening test, then definitely the answer should be the pap smear. And here we are taking the smear from the ectocervix as well as the endocervix, and we are sending it for the cytological investigation. So we are taking the ectocervix smear with the RS spatula and the endocervix smear with the cytobrush, and we are sending this for histopathological examination. So definitely for the reporting, we require expert cytologist and microscope is required. So pap smear facilities are available from district hospital onwards. And the further confirmation, it is done by colposcopy guided cervical biopsy, and that is going to give the final answer because screening is not a confirmatory test. The next question, if you want to know about a recent malaria transmission in area, then preferred indicator is. Now API, it's an annual parasite incidence, and this is giving us an idea about appearance of the new cases. But it is not showing that only in the recent past, it can be earlier infection also, because the chronic malaria cases can persist. So it is suggestive of malaria transmission. Now ARI, annual rate of an infection, it is an indicator of tuberculosis, and it is actually the tuberculin conversion index. Now infant parasite rate, yes, it is an indicator of the recent malaria transmission. And annual blood examination rate, it is giving us an idea about the operational efficiency of a worker. So these are the various indicators related to the malaria program which we have discussed in detail as an API, infant parasite rate, annual blood examination rate, slide positivity rate, and spleen rate. A pregnant lady had a rabid dog bite with minor scratch, line of action. Now here, they had simply given you this word to confuse, because what thought we had in our mind that vaccines are not safe during pregnancy. Yes, some vaccines are not safe, especially the live vaccines, but yes, the kill vaccines or the life-saving vaccines can be given. So obviously the rabies vaccine is a life-saving vaccine if you are having a doubt about rabies infection. So the question is that a pregnant lady had the rabid dog bite and with a minor scratch. So this is another clue that giving us an idea that what is the grade of the dog bite, because our management depends upon the grade. So if we see that what are the various grades of the dog bite, this is again a screenshot from the notes only, that the grade 1 when there is only the lick on intact skin, the grade 2 where there is a scratch or nibbling on the skin but blood should not be there, खून नहीं आना चाहिए. अगर खून आ गया, so that is the grade 3 bite. So grade 2 is the scratch or the nibbling on the skin without blood, and the grade 3 is lick on the intact mucous membrane because the single lining layer, and from this the organism can very well pass and directly enter into the blood circulation. So lick on the intact mucous membrane or the multiple lacerated wounds or a bite with blood, all are coming in a grade 3. So as per our question, it is a grade 2 bite. And how we are going to manage? The management of the grade 1, only the reassurance, no treatment is required. In the grade 2, we are giving the vaccines only, and in the grade 3, we are giving the local care, immunoglobulins as well as the vaccine. So coming back to the question, that as it is a grade a 2 bite, now the options are clean the wound, no vaccine. No, we are requiring to give the vaccine, so this is not an correct option. Clean the wound with the vaccine, yes. The clean wound with vaccine and immunoglobulins, as grade 2 immunoglobulins are not required or no action is needed. So the correct answer is that we have to clean the wound and give a vaccine, because anti-rabies vaccines, they are safe in pregnancy. Person reported to ophthalmic OPD with vision of less than 3 by 6 in right eye. So this is one clue, the vision less than 3 by 6 in a right eye, and the finger movement and 1 meter distance in a left eye. So in the left eye, it is the finger movement at 1 meter, and the right eye, the vision is less than 3 by 6. His state of the vision is. Now again, there is little bit controversy in this question, because some students were saying that the vision in better eye was 3 by 6, and some students were saying it was less than 3 by 6. So in both the cases, the answer will change. Okay. So if we say that what are the various categories of a blindness, the blindness categories as per the old and the new classifications. As per the old classification, we can say that normal vision is if it is between 6 by 6 to 6 by 18. We can say the low vision if it is less than 6 by 18 to 6 by 60 as per the old classification, but as per the new classification, it is a mild visual impairment. Severe visual impairment when the vision is between less than 6 by 60 to 3 by 60, or it is economic blindness. So those who are saying that it was 3 by 60 in the better eye, so the answer is economic blindness. But most of the students were saying that vision was less than 3 by 60 mentioned in the better eye. So they are coming in the category of social blindness, where the vision in the better eye was less than 3 by 60 to 1 by 60. So correct answer for this question is social blindness. The other categories are the manifest blindness if it is less than 1 by 62 perception of the light present, or the absolute blindness when the perception of the light is present, less than perception of the light present to perception of the light absent, or unspecified, the categories 9 of blindness as per the new guideline. So the correct answer, if you consider that the vision in the better eye is less than 3 by 6 in a right eye, and finger movement and 1 meter distance in the left eye, the answer is social blindness. A cardboard worker is at a risk of. Again, there was a little bit controversy in this question. Some students were saying that this was only the question, the cardboard workers is at a risk of. Now we know that cardboard is being prepared from the sugarcane bagasse. So these workers can inhale the sugarcane fibers, and we know that pneumoconiasis developing with the sugarcane fibers is bagasosis. So the answer is bagasosis. Now few students were saying that a question given was that a cardboard worker who is working in a wood industry for a few years, in that case the agent which is causing the manifestation is the wood dust, and we know that wood dust can cause nasopharyngeal carcinoma. Okay, but still the most of the students were saying that only it was a cardboard worker is at a risk of which manifestation. The question was asked like that, so the answer to this is bagasosis. A man traveled to Assam, and after returning back he developed the fever. So one clue is that he had gone to Assam, and after returning developed the fever, giddiness, and on investigation confirmed to be a case of Plasmodium falciparum. They had clearly mentioned, because in the northeast states the high possibility of Plasmodium falciparum infection. So what is the treatment of a choice? Now as we know, as per the guidelines of National Vector-Borne Disease Control Program for malaria, The drug of choice is different if the person is living in northeast states or in other states, as well as for Plasmodium falciparum and for Plasmodium vivax. Now, if you see the treatment guidelines, this is again I have taken a screenshot from our class lectures, that the treatment guideline for Plasmodium falciparum, it is equal for the individual living in all the states, and it is the chloroquine is the drug of choice. With primaquine we are giving as 0.25 milligram per kg the body weight to be given for 14 days. This is to avoid the relapse cases. But if it is a Plasmodium falciparum, as it is clearly mentioned in our question also, so in northeast states, the drug of choice is artemether-lumefantrine, and in other states it is artesunate, sulfadoxine, and pyrimethamine. And in both the conditions, we are giving the single dose of primaquine 0.75 milligram per kg. But if a lady is pregnant with malaria infection, then the drug of choice is different. If it is a Plasmodium vivax infection, then chloroquine is recommended in all the trimesters and primaquine is avoided because it is having some adverse effects. But if it is a falciparum infection, then in the first trimester, the drug of choice is quinine only in all the states. And in second and third trimester, if it has been confirmed with the falciparum infection, then depending upon the geographical location, if it is in the northeast states, the drug of choice is ACTL, means artemether-lumefantrine, and in other states, artesunate, sulfadoxine, and pyrimethamine. And again, primaquine is withheld. So, coming back to the question that the person is returning from the Assam, from the northeast states, and treatment of choice for falciparum is IV artemether. The doxycycline, it is given as prophylaxis. The chloroquine is for vivax infection, and artesunate, sulfadoxine, pyrimethamine, it is for falciparum in other states other than northeast. Food component help in healing, and we all know that vitamin C, it is helping in wound healing. This question we can say it is having the overlapping with the orthopedics. A patient from Bihar presented with generalized bone pain and had an excess of fluoride intake. He was diagnosed as a fluorosis. The fluorosis of the bone is commonly associated with osteosclerosis, and here the dental fluorosis is shown in the image. And we all know that normal fluoride level, it should be around 0.5 to 0.8 ppm in our drinking water. The upper limit which is acceptable is up to 1.5 ppm or 1.5 milligram per liter. If it is between 1.5 to 3, it is causing the dental fluorosis. If it is between 3 to 6, it is causing the skeletal fluorosis. And if it is more than 10, it is causing the crippling fluorosis. And if it is less than 0.5, it is causing dental caries. So both the ends are risky. The excess as well as the lesser amount is risky for the health. And if there is high fluoride content, we have to do the defluoridation. This is done by Nalagonda technique, and we are adding the lime, alum, and the bleach powder in order to reduce the fluoride content. And if it is the less fluoride content in that area, we are using the fluoride containing toothpaste. But remember one point, always there is written as a warning signal that fluoride containing toothpaste to be avoided by children. Why? Have you ever thought for that? The reason is, have you ever seen any child brushing the teeth? The child is not spitting out the toothpaste, the child is swallowing. So if you are giving the fluoride containing toothpaste to a child who is swallowing that toothpaste, it will leading to accumulation of the fluoride in the body and may cause the symptoms of excess of fluorine in later life. So they should be avoided. A patient with fever was investigated and the peripheral blood smear shows following features. Identify the condition. Now, as you could see in the image that there is ring form is seen in RBCs and the single ring form is visible. 1 point. And this form is almost covering the half of the size of RBCs, the little bit bigger. So they are in favor of ring form of Plasmodium vivax infection. As we had discussed in our classes that how we can differentiate the blood smear of a vivax to the falciparum. In the vivax, we are seeing the single ring form, while in the falciparum, we can see the 2 or more ring forms are there and their size is smaller. Now, if you see their trophozoite form in the vivax, the trophozoite form, the nucleus is amoeboid in shape and is covering more than 2/3 of the cell, while in the falciparum form, it is round and it is almost covering the 1/3 to half of the cell. And the most important is the gametes. Now, in the falciparum, the gametes are the crescent shaped or banana shaped, while in a vivax they are round. So by these features we can differentiate whether it's a vivax infection or falciparum, and that's why we all know that we are preparing the 2 type of the slides for diagnosis of malaria. The one slide, it is a thick slide where we will be confirming that malaria parasite is there, and we are preparing the thin slide then to see that which malaria parasite is there, as we had discussed just what is the line of management, because it depends upon the parasite species. The drug of choice is different for vivax and falciparum. So answer to this question is, it is Plasmodium vivax. Patient presented with liver cancer who is working in grain industry, that's a groundnut industry, for last 15 years, the toxin responsible for this condition. Now we know that the grains are stored, and if there is a moisture, they are getting the contamination with a fungus, Aspergillus flavus, and which is liberating the toxin, that is aflatoxin, and it is causing aflatoxicosis. So here the answer to this question is aflatoxicosis. The BOA is the toxin beta oxalyl aminoalanine, which is causing the letharism. Pyrrolizidine, it is the toxin which is responsible for pyrrolizidine, it is a toxin which is responsible for endemic ascites. Next question is, patient presented with liver cancer who is working in grain industry for last 15 years. Toxin responsible for this condition. We know that grains, if they are stored in a moisture environment, they are prone for fungal growth, and this is responsible for a condition that is aflatoxicosis because of a toxin, aflatoxin. Now some other toxins like BOA, beta oxalyl aminoalanine, it is responsible for letharism. Pyrrolizidine, it is responsible for endemic ascites, and sanguinarine, it is responsible for epidemic dropsy. As we know that PSM is little bit difficult to remember, so we remember them by mnemonics in our classes, and that is very simple, very easy to remember forever. So how we can remember the toxin responsible for epidemic dropsy and endemic ascites, because that is very commonly asked in examination, so we can remember by a mnemonic. We all know that our friends, some of them are doing the dental course, BDS course, so you can remember like that is EDS BDS, means epidemic dropsy. It is caused by a toxin, that is S is sanguinary. If you are not able to remember the whole name, you can just remember S is for sanguinarine, it is for epidemic dropsy. Now how you can remember the pyrrolizidine for endemic ascites? We all know that we are using the mobile apps, so you can remember like EAP or app. So endemic ascites, it is because of pyrrolizidine. So in this way you can remember the toxins, and we have discussed all these food adulteration conditions in detail in our classes. Which level is taking care of school health in a rural area? We know that in school we are doing 6 monthly health checkup of students, and this is done by medical officer. And we know that medical officer is posted lowest center as primary health center. So sub center is not an option because sub center is not having the medical officer. Here only the multipurpose workers are posted. Now, community health center, it is having their specialists. They are involved in other activities, and sub-district hospital is further above the community health center. So, here the correct answer to this is primary health center. A 30-year-old lady presented to the OPD with complaints of lower abdominal pain with history of copper insertion 3 years back. So, in a lengthy question, we should try to identify the keywords as well as we have to look for the image. Now, if you look for the image, if you can appreciate, they had given us that this is the bladder and this is the uterus longitudinal section, and this is somewhere they had mentioned is IUCD. So, they are talking about this shadow which is looking like an IUCD. So, they are asking something related to the pelvic area with IUCD. And quickly we see the option that it is removed by. So they are asking that how we have to remove this displaced copper T. So by the image and by the options, this is in our mind. Now we have to find out at which place this copper T is displaced. So with this thought, we have to look for the keywords in our question. A 30-year-old lady, okay, so lady is in the reproductive age, presented to the OPD with complaint of pain in an abdomen and history of copper T insertion 3 years back. So they had confirmed that copper T was inserted 3 years back. On ultrasound investigation, it was confirmed that copper T is extrauterine. So they had mentioned that it is outside the uterus near the ovary. So a job is done. It is outside the uterus, so we cannot remove by hysteroscope because this is the scope of uterine cavity. We cannot remove by colposcope because this is the scope of cervix. Not by pulling the thread because thread also might have gone along with the copper T. So the correct answer to this is laparoscope. So by putting the laparoscope in the abdominal cavity, we can take it out. And in our lectures, we have seen these images showing the displaced IUCDs. Now if you see the image number 1, this is showing the normal position of the copper T. This is the longitudinal ultrasound section, and image number 2, it is the transverse ultrasound section. Image number 3, it is showing the displaced copper T, but this is inside the uterus moving towards myometria. It can be removed by hysteroscope. Now image number 4, it is showing the displaced copper T down in the cervical canal. And if the thread is visible, it can be removed by pulling the thread. And if the thread is not visible, then it can be removed by hysteroscope. Image number 5, it is showing the IUCD with gestational sac. This is in a case who is presenting with pregnancy with IUCD in place. And if the thread is visible, then simply by pulling the thread, we can remove the device. Now remember one point, forever, that we are not putting the hysteroscope in pregnant uterus because uterus is soft, we may perforate. So it is removed by simply pulling the thread. And then we have to decide whether the patient wants to continue the pregnancy or patient wants to abort. Now image number 6, it is the X-ray of a lady where copper T is displaced, and this is in transverse plane. Because barium sulfate is present in the copper T, so it is clearly visible in X-ray also. And you could see the image number 8. It is IUCD, but it is not in copper IUCD, as you could see the bulge in the vertical arm. So this is actually the capsule which is containing hormones. So this is an image of Mirena or LNG20, which is again displaced, and this is again an image of Mirena which is displaced. So these are the different images of displaced or misplaced IUCDs and how we are removing. We had already discussed. The next question is, which workers are more prone for fever in the given observation? Now this diagram I had prepared with the information which I can collect from the students. That pie chart and the bar chart was given, and we know that pie chart and the bar chart, they are the qualitative data presentation methods where we don't require any calculation. By simple observation we can assess that which value is more. So you could see that value covering 60% is by the farmers having the fever possibility. And if you can see the bar chart also, the height of the bar is more for the farmers. So here the answer to this question, that which workers are more prone for fever, are farmers. Vaucheray bankrupti cannot be seen in. Now commonly the Vaucheray bankrupti are seen in the lymphatics, and we can see in blood smears also, especially the microfilarias. But sometimes they are also seen in urine, ascitic fluid, and the pleural fluid, as well as the pericardial fluid. But very rarely they are seen in salivary secretions. So among the given choices, the best suitable answer is saliva. A child presented with history of a diarrhea for last 12 hours, severely dehydrated and unable to drink. So here the keywords are that baby is severely dehydrated and unable to drink. So obviously if the baby is not able to drink, then we have to manage by giving the IV fluids. And this we had discussed in our classes also, that in the severe diarrhea we are giving an IV fluid. Total IV fluid amount is 100 ml per kg to be given in 2 divided doses. The first fast 30 ml per kg to be given in half to 1 hour, and the next 70 ml per kg to be given in 3 to 6 hours depending upon the age of the baby. And the fluid what we will prefer, either the diarrhea treatment solution, if it is not available then ringal lactate, not available the normal saline. But remember 5% dextrose is not used for treatment of diarrhea because it is not having any electrolytes. So the answer to this question, the ORS is not possible because baby is not able to drink. IV ringal lactate, yes. Normal saline, if a ringal lactate is there, we have to prefer over the normal saline. Dextrose we are not using. The correct answer to this question is, it is IV ringal lactate solution. Given condition is due to the deficiency of. If you can see the image, the baby is looking like the bulging abdomen, looking like a edematous baby. And this is a classical picture of kwashiorkor baby, because you could see the hair texture is also not good. And we know that kwashiorkor is having only the deficiency of the protein. The energy is not deficient like marasmus. Now we had seen these two images in our classes also, when the marasmic baby are having the deficiency of the energy and the protein both. So here the muscle mass is also reduced, while in kwashiorkor babies the energy is normal but protein is less, so they are having hyperproteinemia, and because of that there is edema. So here the correct answer is that only protein deficiency. Most common cancer in head and neck area in India is oral cancer. As we know that in India, the people are in a habit of eating the tobacco with all the katha chunas, and this material is under the cheek throughout the day, and they are so smart that they can even drink with this, they can eat, they can talk, they can sleep, everything they can do with the material in place. So it is causing the constant irritation leading to the cancer developing. And this condition is so miserable that some youngsters, they have to lose their life, or after the surgery they had to cover their face throughout the life with a towel or hanky just to um, hide this deformity. Now, the females are also not behind, they are following all the characters or the features of what the male are doing. So, they had also started eating this tobacco product, and it is reflecting in the form of infertility in their reproductive age group, or those who they conceive, they had abortions, or even if they continue till term, the baby has the withdrawal symptoms. Baby says, "Mom, you had used the tobacco throughout the 9 months. You had given me the tobacco. Now I want tobacco." Baby shows the tobacco withdrawal symptoms. So it is very, very a dangerous condition. And we had discussed in detail that what are the various causes of cancer in our classes. That in a male world, the lung is the most common cause of cancer, while in India it is the oral cancer, and in female, both in India and the world, it is the breast cancer. If we see the overall most common cancer in the world, now the breast cancer is on top. In elderly male, it is the prostatic cancer. The young male, it is testicular cancer. Occupational cancer seen in India, it is the skin cancer, and the cancer in female in rural area is still the cervical cancer. Next is a 30-year-old person is coming from China with suspected COVID symptoms. Now test for confirmation. Now there should not be any confusion because for past 1.5 years we all are facing corona pandemic, and some of you might have undergone this testing either for confirmation or for the screening, and the answer is none other than RT-PCR. Identify the virus. Now if you could see carefully, now we can see the glycoprotein 120, that is the docking protein, which helps in attachment of the virus to the host cell membrane. Transmembrane protein through which virus is entering through the membrane. Then we are having the nucleic acid protein 7. With the help of the protease, reverse transcriptase, and the integrase enzyme, it is functioning. And this we had already discussed in detail in our classes. This is a screenshot of our class lectures, as well as the online lectures and the MIST app applications. All these points has been discussed in great detail. So correct answer to this is virus is none other than HIV virus. The first step to be done for immunization survey in an area. We know that immunization survey is done by cluster random sampling, and the age group of the children selected are between 12 to 23 months of the age. So we have to find out the children of the last 1 year vaccinated, and then now we'll see that for how many vaccines they are left, and we are giving them the remaining left out vaccines. So answer is that vaccinated children in last year. Doctors are doing a work in the extracurricular activities. The study design plan to know for future requirement of the doctors which are doing an extracurricular activity. Identify the analysis. Now here basically we are comparing the two groups. The one are the doctors who are doing their work with extracurricular activities, and another group is the doctors who are only doing the work, and we are finding out that which is better in terms of overall cost effectiveness. And if we say that those doctors who are doing their work with extracurricular activities, if they are found to be better, then we are finding their future requirement. So this analysis system is systematic analysis. In the cost benefit, only we are comparing the how much cost we had uh, invested and how much in refund money we are having. So the difference in the investment and what return we had. It is cost benefit analysis. Cost effective means how much money we had invested and how much benefit we are having in terms of the results. Like we had invested in the vaccine manufacturing and how much reduction in the maternal mortality or how much reduction from the deaths in the corona patients we are having. That is cost effective analysis. Network analysis is a chain of events leading to the end point, and systematic analysis is comparison of the two activities in terms of their overall cost effectiveness. So here the correct answer is systematic analysis. A case control study was done to know the risk factor of obesity. Two groups formed will be. Now here they had clearly mentioned that we are conducting the case control study. If we see the study design which we had already discussed in our classes, this is the screenshot from our class notes, that if we are doing a case control study, then we are making the two groups. One is the cases where the disease or the outcome is present, another are the control where the outcome is absent. And here the outcome what we are taking is the obesity. And then we have to go in a backward direction to ask for the risk factor, which can be their food intake, which can be their exercise related, which can be their habit of the smoking. So this is the study design of the case control. While if we want to do the cohort study, which is a forward study, so we'll start the study where the individuals are healthy. So we'll make the two groups. One is exposed, another is the non-exposed. We are exposing them to the risk factor, waiting for the some time for the disease to develop. So this is your cohort study. So coming back to the question, what they had asked is the two groups in a case control study to find out the risk factors for the obesity will be the patients with obesity and without the obesity, not the person with or without the online food, because these are the risk factors, not the person with or without the exercise, because this is again a risk factor, not the person with or without the smoking, because this is again the risk factor. So correct is patient with and without obesity. Demographic bonus is. Now, actually, what is demographic bonus? The country which had the high fertility rate in past few years, suppose more than 20 years back, if the country is having the high fertility rate, and for the last 20 years with the use of contraceptives, they are reducing their fertility rate. So now the non-working population is reducing. And those who had born more than 20 years before, now they had entered in an age group of more than 15 years, so they are now working. So our dependency ratio is reducing. We had a lesser number of the less than 15 years of population. We had a more number of 15 to 65 years of the population. This means this is the bonus because of high past fertility rate. So the correct answer to this is, it is not related to population density. The reduction in the population in the last few years due to contraception, yes, this could be the answer. Fertility rate, no. It is literacy, no. So here the correct answer is reduction in the population in last a few years due to contraception. Reproductive health promoting agency in world is. It is UNFPA, United Nations Fund for Population Activities. Now this is funding developing countries to carry out their different activities related to reproductive health. Which agency gives support to achieve sustainable developmental goals? We know that sustainable developmental goals are given by United Nations for a year of 15 years from 2016 till 2030, and this is for overall well-being of society or whole world. And there are the 17 goals are there, and only the goal number 3 is directly health related, and their branch, that is UNDP, United Nations Developmental Project, is helping the developing countries to achieve their sustainable goals. So correct answer is UNDP. Agency funding tuberculosis program in India is United Nations Agency for International Development. It is funding India to carry out the control activities related to various infectious diseases as well as non-communicable diseases. So friends, these were 41 questions which I could collect, and in the last I can say success only comes to those who dare to attempt. And as you all dare to attempt your examination, so yes, definitely you all are going to achieve the success, and we all are waiting at finishing line to welcome. So with these words, wishing you all the very best for your life. Good luck. Bye-bye.